This is a potential image based question which can be asked in the future exams. Diagnosis is correct. So next challenge is to tell and to know what are the associations of this Xanthelasma palpebrum. So in the options we are having normolipidemia, type 3 or familial dyslipoproteinemia, and primary biliary cirrhosis, and also none of the above is there in the options. So if you are thinking the answer is B, which is not the proper association with this condition, then your answer is correct. So let us see few points about this Xanthelasma palpebrum. So it is the most common cutaneous xanthoma. Okay, so the term xanthelasma is derived from the Greek word xanthos, which means yellow, and elasma means beaten metal plate. So if you beat a metal plate, then it is going to appear as a flat, it will become flattened. So the lesions here are also going to appear, and they are going to have the characteristic color which is yellow color, and they are going to have flattened type of appearance. That is, you can see that it is not so very raised, it appears to be a small flock. If you touch it, you can feel it. Okay, so it is characterized by yellowish flocks occurring most commonly near the inner canthus of the eyelid and more often on the upper rather than the lower eyelid. So you can see that this particular picture is very characteristic and classical descriptive term which can be used to explain the xanthelasma palpebrum, that is having the lesion is there over the inner canthus and also mainly over the upper eyelid. Lesions are symmetrically distributed. You can see bilaterally the lesion is present, maybe singular or multiple, and nodular and flat and soft semicircular. So all these are possibilities. So here you can see these are all the possibilities. Here you are able to see that this is very much raised lesion. Here there are few tiny lesions which are coalescing to form a larger block. And again, this is the picture which I have kept in the today's image based question. So you should remember that yes, this Xanthelasma palpebrum is associated with abnormalities in the serum lipids. So always whenever a patient comes up with these kind of lesions in the inner canthus, we should get the lipid profiles done. But it was observed that almost 50% of the individuals who have this condition are going to have absolutely normal lipid levels, and if at all there is association with the lipid abnormalities, it was noted that type 2, that is familial hypercholesterolemia, is the one which is associated with this Xanthelasma palpebrum, but not type 3, that is familial dysbeta-lipoproteinemia. It is not associated with type 3 hyperlipidemia. And it was also observed not only normolipidemia and type 2 hyperlipidemia, even primary biliary cirrhosis was also associated with this Xanthelasma palpebrum. So we need to also monitor the patient in case in future the patient is going to develop any such lipid abnormalities.